We know that the government has to introduce legislation supported by regulation to deal with the abortion issue on foot of the X case ruling. It follows on the public outcry following the death of 31-year-old Savita Halapanavar, who died back in October following a miscarriage at Galway University Hospital. The legislation is expected to be framed by April of next year. Now, already the Catholic Church is out of the traps, calling for a free vote on the legislation, which would allow TDs to vote without the party whip and based on their own beliefs. In studio with me, Independent Senator Ronan Mullen will be joined also by Labour Senator Ivana Bacik. But first of all, you may have heard something of this. In the Seanad yesterday, Senator Ronan Mullen accused the government of doublethink for condemning the deaths of children in the Sandy Hook shooting while showing no concern for unborn children.
I find it entirely appropriate that we would join in solidarity with the people with the children who died in Connecticut. Let's be sincere about that. And let's not slip into a doublethink either, however, where we forget a whole category of children in our own country. The government has a very serious decision to make in these weeks and months on the abortion issue, as we all know. I find it very troubling that, having done so well as Minister for Children, Minister Frances Fitzgerald in her speech yesterday appeared to show no concern for unborn children. A whole category of children are in danger of being excluded. And I find it disturbing in these days. If I might just, well, my question is, I would like just to draw the attention of the House that Minister Fitzgerald and indeed the UN rapporteur, I mean, how dare he call Ireland's maternal care into question and make comparisons with India, when India sadly is a death trap for women in terms of maternal care.
How could you link the deaths of children in Connecticut to this debate?
Some of what went on in Seanad Éireann. Well, Senator Ronan Mullen is with me now, and on the telephone, Labour Senator Ivana Bacik. Ronan, good morning.
Good morning, Pat. How are you?
Yesterday you did cause some consternation in the Seanad when you linked the killing of the school children in Connecticut with the issue of abortion in this country.
Well, I didn't actually accuse anybody of anything. You suggested that I'd accuse the government of doublethink. I offered my comments, I think appropriately, in a reflective spirit. There's probably a tradition in the Seanad when there's a tragedy or indeed when there's good news that people like to either express their condolences or their congratulations. For example, the late great Paddy O'Shea was the subject of many references, and it was right and proper that we would remember what happened in Connecticut. But we were also talking on a day when the government, I had read Frances Fitzgerald's speech the previous day, no mention of the unborn child in her speech. I've said on the radio, what this comes down to is some people see two patients, one patient, pro-life people see two patients. And therefore, I think it is appropriate that I would just have, and I did so in a reflective spirit, and I encourage my colleagues not to fall prey to doublethink by forgetting a whole category of children. And certainly that is what's happening when the government proposes to introduce legislation that on a threat of suicide you can have an abortion, when there is no credible medical evidence to show that abortion is any kind of therapy.
However, that was the feeling and the finding of the Supreme Court, and they're stuck with that unless they go back to the country and try and undo the 1983 referendum.
That's right, and it is interesting and surprising, and it does make me wonder why the expert group chose to read its terms of reference so narrowly and not even to consider that option. Because we do need to remember the European Court of Human Rights.
You were young at the time,
yes,
but it was at the instigation of pro-life groups that this amendment, which was deemed by a lot of people at the time as being unnecessary, that this was inserted into our Constitution.
Well, you're right, I was 13 when it was passed. But I've read a lot about it, and I have to say that despite the Supreme Court interpretation, which I think has been hugely problematic, they heard no medical evidence in the High Court, as you know, no time limits, and no mention of duty of care to the unborn. And that's why I think John Bruton was to be admired, I think back in 96, 97, when he was in government and he was asked, would he legislate for the X case? And he said no, and when he was asked why, I think it was on 6-1, he said because that would have the effect of bringing abortion into Ireland. And I just, a great example of how sometimes doing nothing is a lot better than doing harm. But going back to the 83 amendment, in many ways it has proven to be a very good amendment in that it does enshrine a noble principle. I gather it was pro-life.
Going back to the nub of this,
yes,
where doctors are looking for clarity, and Peter Boylan, a member of the expert group, asked for that clarity. situation, someone claims they are suicidal, and you may agree or disagree with the psychiatric ability to determine such a contention on the part of a woman. The doctor says, I don't believe you, but he's proven wrong, or she's proven wrong by the death of that person, and doctors are saying, in a situation like that, we want protection. And that it's as simple as that. Yeah. They want protection for a decision that they make, maybe with the best of medical intentions, but they get it wrong.
Yeah. Well, look, the best people to talk to about this are the psychiatrists. My background is legal and political, and I'd never claimed to enter into an area where I don't have direct competence myself. But what the psychiatrists will tell you, first of all, is that there is no medical evidence to show that abortion is any kind of therapy. The debate is about when abortion itself causes problems, and there's controversy there, but there are also papers there. For example, Finnish study, ongoing study, shows many times more risk of suicide as a result of abortion or after abortion, as opposed to going ahead with the birth.
Well, we should have a very good cohort for a study here, because as Francis Fitzgerald, the minister you mentioned, pointed out, 4,000 Irish women elect to go for abortions in Britain every year.
Yes.
So going back over 30 years, a huge number of people would be available for that kind of study.
And I gather that none of the, it's just some study that was drawn to my attention the other day, and I don't have it to hand, but that apparently since 1992, none of the Irish abortions attributable to any alleged threat to life. Which I think is very interesting when you consider that a mental health ground is the Coach and 4 that has given us nearly 200,000 abortions in Britain every year.
But the point again made by Peter Boylan this morning was that in the situation where they've elected for an abortion, if it was to be to save their own lives, well, they've self-medicated, if you like, by going to Britain. So that cohort, we may never know, we can never know, perhaps what the mindset was as they took the boat of the blame.
Yeah, well, I think Peter Boylan, with great respect to him, is an obstetrician, and what he wasn't able to do and didn't seem to want to go there was this position of what do you do with a child of 20 weeks in the womb. I mean, think about this. The Supreme Court mentions no time limits. The government would have us believe that, well, if the child is close to viability, you'll let the child get that far, and then take the child out living, presumably. Are they proposing, for example, that very sick children would be brought out early in that situation? And what about the child who's 17 weeks in the womb, Pat, maybe 5.5 inches long? Let's just get a mental picture here of what a child in the womb of 17 weeks looks like. And I shouldn't really be down to what a child looks like, but you're talking about taking that perfectly healthy child's life. His mother or her mother is perfectly physically healthy. And by the way, I think what psychiatrists will also say, and again, I'm only quoting them because it's not my area of competence, they will also say that doctors may well find themselves, Francis Fitzgerald is suggesting that people are going around saying, women will deliberately feign suicide. I don't use that kind of language, but I noticed Kathleen Lynch, her fellow minister, seemed to be suggesting that that's what women would have to do under the legislation that's proposed. So the government doesn't seem to know where it stands. But what psychiatrists will tell you is that doctors will want to cover themselves. And in the same way that doctors frequently prescribe pills when, to make the patient feel happy, it may very well be that doctors will start to try and say this is an unworkable law, it's ridiculous, and you will end up, as the late Anthony Clare said about his time in Bermuda, with psychiatry being used as a justification for abortion inappropriately.
Senator Ivana Bacik, you've been listening to Senator Ronan Mullen. First of all, I'll ask you for your view on the course that the government has decided to take. Is it, by your lights, the right one?
Yes. First of all, I would just like to say I very much welcome the government's decision announced yesterday that they will be introducing legislation with regulations early in the new year in order to implement the judgment of the Supreme Court in the X case 20 years ago, and of course also to comply with the judgment of the European Court of Human Rights. I think anyone who reads the expert group report, which is a carefully crafted and really well considered report, I think will see that legislation and regulations is by far the best and most appropriate way to provide the sort of legal clarity that doctors clearly require. And, we've been having this debate for 20 years, and I've been listening to Ronan for a large chunk of that. And I suppose I should also
We're
say...
We're 5 years in the shadow together, isn't that right?
I must say that as a parent myself, as a mother of 2 young daughters, I found it utterly crass and insensitive to make any sort of comparison with Sandy Hook. I just want to say that because I listened with disbelief to that exchange in the Shannon yesterday that you just played earlier. I think it was really inappropriate. Just in terms of some of the points Ronan is making, I mean, there's been very clear points made made by psychiatrists, eminent psychiatrists like Professor Veronica O'Keefe from Trinity, that psychiatrists are well trained and well experienced in assessing suicide risk. That suicide risk is a very much higher test than the test on of mental health in England. And so to suggest that suicide risk is in some way going to bring in a sort of abortion on demand in Ireland is really just, far-fetched. We know that in England only very small numbers of women have abortions on the ground of risk to life, because in most cases, as Peter Boylan said earlier this morning on Morning Ireland, in most cases abortions are carried out before that stage when there's because risk to health is a ground in England. So, really the comparisons with England are difficult to make. But we do know that 4,500 Irish women travelled to England last year from Ireland. So abortion is a reality in Ireland and always has been. And, to suggest that it somehow doesn't happen here, I think is very misleading. There's about 150,000 women in Ireland who've had abortions. And I think, we do have to recognise and acknowledge that. But it is important that for the very small number of cases every year where women do face a life-threatening pregnancy, that we have legal clarity about when doctors may intervene. And I suppose just the other point that Ronan was making, which is something that I think the anti-choice people have been doing a lot, which is the scaremongering about time limits. And, just to say this, that the expert group report in Chapter 6 sets out a very clear blueprint for legislation and makes the point that where a fetus is close to viability or is viable, that of course then a pregnancy can be terminated and should be terminated without terminating the life of the unborn. So a baby can then be delivered in order to save the mother's life and can be given the normal neonatal care, and that's what happens anyway. So to suggest, as Ronan has done,
it's not that simple. And it's me, it's interrupting you. I just want to put it to you, Ivana, it's not that quite that simple. We know that viability, 22 weeks perhaps, 24 weeks perhaps, 27, 28 weeks, still some health risks and so on. And as a lawyer, the possibility that later on that person's own behalf, by a parent or indeed by that person themselves when they reach the age of majority when they can actually take legal action, they could so do against the obstetrician, the hospital and so on, for delivering them in a situation that left them with catastrophic disabilities. So it's not that simple,
well, again, I think, Pat, just to look again at what the expert group report says, and it makes the point that, of course, each case would have to be considered, each woman and each threat to life would have to be considered on its own facts and on its own, on a case-by-case basis. And that's why the expert group suggests you would have two doctors in each situation making a clinical assessment, that where a termination is refused by those two doctors because they don't believe the pregnancy poses a risk, a real and substantial risk to the woman's life, that then there would be a review panel that could be convened swiftly so the woman could go to get a third medical opinion if required to assess that. So I think it's very carefully set out about how you assess risk to life, and it's a very restrictive test. I mean, many of us, myself included,
I'm going forward. The law of unintended consequences often will come into play. So the two people say no, you can't have a termination. The appeal says no, you can't have a termination. The woman takes her own life, leaving behind perhaps children without a mother. They, in turn, when they get a chance, take legal action against the people who've made those decisions on the basis that they were deprived of maternal care.
Well, so that is an appalling
but these are the kind of cases. The X case was anomalous. The A, B, and C cases were anomalies.
Let's say this, Pat, that appalling scenario, which of course we would all dread to think might happen, that could happen today. It could have happened at any time in the last 20 years. I suppose the advantage of having legislation, which I hope we will have very early in the new year, will be that it will provide clearer criteria for doctors and indeed psychiatrists in making that sort of risk assessment. And it will give women indeed more clarity. And I mean, 20 years ago in the X case, late Judge McCarthy put it very poignantly, what is a pregnant woman to do and what are doctors to do, and said even in 1992 that it was inexcusable that the legislature had not clarified the test set out or how you balance competing rights as set out by the people in the 1983 amendment between the woman and the unborn.
Ronan, therefore, I mean, if the government is pressing ahead, which it appears it is, and will be using the whips to make sure that people vote in accordance with whatever is the outcome.
In the normal way, as we normally do with government legislation. There's nothing unusual in that.
There's nothing unusual in that. But given that they're going to do that, should not the task that your side of this argument sets itself to is bringing in the kind of regulations that will satisfy all the concerns that you have?
Well, Pat, I, on a previous occasion on this show, made it very, very clear that I completely 100% support giving clarity so that doctors know exactly what they have to do whenever they need to save a woman's life. And the evidence from the Irish maternal care is that they do it, and they do it excellently. We are consistently there or thereabouts in the lowest maternal mortality in the world, which is why I took such exception to Mr. Grover, the UN rapporteur, who has a track record in promoting abortion. Even though there is no UN right anywhere, he has been criticised by different member states, for example, for trying to expand the area into abortion rights. This is a guy on a mission, and he comes to Ireland then and he compares us with India, which has disastrous maternal mortality rates, not to mention other problems like gendercide, where girl children. Ivana took India out of my motion last year in the Shannon. Didn't want India or China mentioned when I brought forward a widely supported motion on gendercide and the way children are targeted for their gender in such countries. You know, instead of demonising people like me as anti-choice, you know, which is a phrase I don't go around calling Ivana pro-abortion. I think we're all entitled to the terms that we apply to ourselves.
But we're all pro-life, Ronan. Everybody is in favour of life, and I think it is a term that's unfortunately been appropriated by one side.
I think the position is that some of us see one life, others see two lives, and what I have always supported is best medical care for women, including where it is foreseeable that the child can't be saved, provided that there is a duty of care always to the unborn. And that is our current medical practice. We don't have a medical problem in this country. We have a legal and technical problem. And the tragedy is that the government...
Peter Boylan this morning, he actually extrapolated the figures. He said that people on your side of the argument, I don't know whether you personally have made this argument, is that the floodgates would open. Just look at Britain, where they have mental health as a ground. Yes. And he said that if you were to extrapolate the number from the threat to the life rather than the threat to the mental health, that the corresponding figures for here would be 4, which is not a floodgate. It's a relatively small number. I know you would take the view that a life is a life from the moment of conception, and that life is equal to any other life. But still, it's not a floodgate.
Peter is on one side of the argument, very definitely, and as are a lot of other politicians. And the part of the rhetoric now is to say that this will be extremely restrictive. But what we are conceding here is a principle that you can directly target an unborn human life. And there is no credible medical evidence. The one thing in all her chat there, Ivan, and I don't use that word disrespectfully, by the way, but in all her comments there... Well, no, you want to make me sound like I'm disrespecting you, but I'm respecting you, Ivana, and I do.
Sure you are,
and I've often supported you when I agree with you in the Shannon, and I try and keep my comments courteous, but I do feel I have the right to criticise what people say, particularly when it is outrageously in dereliction of good human rights thinking, and I think your views on abortion are a complete abandonment of human rights thinking. But to answer your question on Peter Boylan, what none of the campaigners on the pro-choice side are able to show is whether they're not able to show a shred of evidence that abortion is any kind of therapy. And you yourself, Pat, to be fair to you, I remember prime time...
If it saves a woman's life, Ronan, isn't that... I mean, you deny this, but I think Peter Boylan was very clear this morning. I think it's most disrespectful, by the way, to say he's clearly on one side and therefore to dismiss him.
No.
He's an eminent obstetrician. Let's just face this.
No, he's a campaigner on this subject.
He suggested that if you extrapolate the figures, there would be about 4 women per year who would face risk to life by virtue of suicidal ideation in pregnancy. Now, as he put it, it's rare, but it is real. It's rare, but it is real, and we have to legislate for those rare but real cases.
No, it's not. It's actually not real. I mean, Professor Patricia Casey was much in a.
What about the X case, Ronan? And the C case.
Let's talk about.
We've had 2 instances of very young girls who were raped.
Well, let's talk about the C case. Let's talk about the C case.
Who became pregnant as a result, and who were suicidal. Yeah. And in one case, a clinical psychologist, in the other case, a psychiatrist gave evidence, which was uncontested, that those girls were suicidal by virtue of being pregnant, and that as a result, termination of pregnancy would be required in order to save their lives.
Well,
that's a clinical judgment that psychiatrists make and that psychologists make.
No, there was no psychiatrist. First of all, Ivana.
I know. A psychologist in the X case.
No psychiatrist in the X case. That's a major thing.
And a psychiatrist in the C case.
And in relation to the C case.
What we're doing now, Ronan, with the legislation legislation is ensuring that in future we will have a clear set of criteria and a clear way of assessing suicide risk and indeed other forms of risk to life, be it physical or by virtue of physical or of mental health, where a woman faces a risk to her life by virtue of the continuance of her pregnancy, and that then the pregnancy may be terminated. But up until now, under the X case, we simply don't have the clarity for doctors or for pregnant women or their families, and it's essential that we have that. So I very much welcome the government decision, and I hope we will see the legislation.
Can I just address
Yes.
that, because Yvonne had a good run. No psychiatrist heard by the X case, and then she quotes the C case. And to be very fair to you, Pat, Prime Time ran several documentaries the time of the C case, several programmes the time of the C case. They never actually followed up. You, to be fair to you, did interview the woman in the C case. And if I understand correctly, what you gathered from her was that she woke up asking for her baby and that she had mental health problems, and in her view, I think, as a result of her abortion.
I think she was very much manipulated by a very
so that's the line. No,
as you well know,
that's the line. No, that's the
I
line.
think there were very particular circumstances.
Oh, were there? Well, it's
Yeah,
interesting.
I think so. If you look back at the
It's
reports
interesting,
of that
Ivana,
case.
that you start off by quoting the C case and now you're trying to discredit
but
it. The fact is
if
there
we
is
can-
no
I'm not
medical
discrediting
evidence.
I want to play just this clip from Frances Fitzgerald because it does inform the debate.
One woman who told me she had voted, as she put it, pro-life in the 1983 referendum, also told me her daughter had had a very serious crisis pregnancy and that she'd taken her for an abortion. I quote, "I vote pro-life to stop irresponsible demands for abortion," she told me. It makes sense and it makes no sense. Just as it makes sense to say that Ireland doesn't have abortion, and it makes no sense when we know Irish women travel to have terminations in our neighbouring jurisdiction. It makes sense to be fearful of change, and it makes no sense to brand women as being duplicitous and untrustworthy, likely to claim suicidal thoughts and pull the wool over the eyes of the medical profession in their efforts to seek the option of an abortion. Since when has it become permissible to make such bold and dismissive statements about women and about people who are presenting with serious mental health problems? Since when has it become permissible to resist the idea that pregnancy might trigger or could exacerbate existing mental health conditions? Let us not go there. Let us not attribute ruthless, uncaring duplicity to women we don't know who in the distant future may have a crisis pregnancy. We don't make progress in that way.
Now, that is at the heart of your side of the argument, Ronan, isn't it? That there will be women who will be duplicitous, who will be uncaring, who will be ruthless, and who will try to cod the psychiatric profession up to the eyeballs. Isn't that really at the heart of it?
No, Pat,
because if you did trust women as a generality, you would not be making that argument that the floodgates would open.
I completely reject that kind of rhetoric, actually. First of all, Frances Fitzgerald is the one who's going around saying that there's people suggesting that women would be duplicitous. Then we have Minister Kathleen Lynch saying this legislation we're bringing forward will force women to pretend that they are suicidal. So I'm not sure what the government's view is of the question of whether women... The people that I am concerned about are those who will use this as a wedge, as they have done in other jurisdictions. Those who will try and say, this is an unworkable situation. They will say it's ridiculous and that we really need to bring further clarity to this situation. And frankly, I don't buy, attempted distinctions between suicidal ideation and mental health grounds, as you have the majority of abortions in Britain taking place on mental health grounds. When I think it was Breda O'Brien last night in RTE who quoted Anne Furedy, who would be very much on the abortion provider side in Britain, saying exactly that mental health grounds get used even when there is actually no danger to a woman's mental health. Now, is it the woman that's being duplicitous, or is it the doctor or the counselling aid? We recently had an expose.
But that is very broad. Mental risk to the mental health of a person is a very broad kind of category. What does does it mean? Does it mean that you're depressed for a few weeks? Does it mean ultimately that you might become suicidal? Does it mean that, there are many different forms of mental...
But if you have, just follow the argument though, Pat, if you have an abortion provider admitting that basically what women are encouraged to do is to say that they have mental health issues, that their life will be wrecked, when that is not the case, then the same will follow. And don't forget, we recently had an expose of the Irish Family Planning Association here, telling women not even to tell their GPs if they had complications after an abortion, that they'd had an abortion, say you need to say it was a miscarriage. So there is a lot of duplicity, and it's not necessarily starting with the unfortunate women who are at the heart of these cases.
Going back to that argument and Peter Boylan's statistics saying that only in a very small number of cases, which would, by comparison with Britain, boil down to about 4 a year, people in mental health extremists, shall we say. However, if the only ground in Ireland is the suicidal ground...
No, it'll be risk to life, whether it's risk of suicide or physical risks.
But the physical risks are probably more easily discernible than any mental health risk. So, I'm just asking you to discuss the point that if this ground is suicide rather than mental health, that perhaps if women in Britain are claiming mental health as a ground when they have no mental health issues, the logic would be that if the only way to get a termination here is to claim suicide, that some women would.
Well, first of all, the test is completely different in the English Act, and as Ronan knows as a lawyer, if you just look at the 1967...
As I said.
And Ronan, and I know, to be fair, he did say that. The 1967 Abortion Act requires only proof of impairment to mental health, so it is very different, and it's a much lower test to satisfy. The test here is, under the X case, real and substantial risk to life, whether that's risk because of suicidal ideation or physical risk. So it is a much more restrictive test, and there really is no comparison. I think, no matter how it's put, those who argue that they don't want to see suicide risk in the Irish legislation because they think it'll lead to abortion on demand, that really is just saying they believe women are duplicitous and will lie to get abortion. And I think it is most dismissive of women, it's dismissive of psychiatrists and the psychiatric profession, and indeed it's dismissive of mental health. And I think it's tragic, when we see such appalling suicide figures, that people somehow don't think mental health or risk to life because of mental health reasons is as serious somehow as physical risk. So I think we need to be very careful. That's a completely
inappropriate extrapolation, actually.
I think we need to be very careful.
Because that's actually inaccurately interpreting what's being said. Because what's being said is that in the 30 years, the 3 main maternal hospitals only had 2 cases of suicide in pregnancy. It's extremely rare. And then it was attributable to mental health issues. There was no evidence that abortion would have done anything to help in that situation. And what we have to address are the situations where abortion might make things worse.
I'm going to draw this to a close because Ronan will have to
go because
get himself into town as well.
Now. But I suppose just to say, I just feel it's dismissive of women and it's demeaning to women to suggest that women will lie.
There is sympathy on all sides for women in that situation, but we mustn't pretend that there's a mental health grounds for abortion when it doesn't help the situation.
To continue this discussion, and it will continue in many different forums, I suggest. But Senator Ronan Mullen, thank you very much for joining us in the studio, and Senator Ivana Bacik, thank you very much for joining us from Leinster House. It's 10:32.